to On One Radio, the talk show podcast station, bringing you the current events and issues. All information and resources are based on the opinions of the host unless otherwise noted. This podcast may contain some quotations, images, and/or excerpts from copyrighted material. These uses fall well within the copyright doctrine of fair use. This is the News Report, and I am your host, Tony. Welcome. I am your host, Tony Williams, and this is your news report. So let's talk news report. What we're talking about today is coming out of Louisiana. Now, we're all well aware of the COVID-19 crisis and how it's been going, and it's been a great fear that we would have waves of it reigniting, basically. Which has actually happened in the state of Louisiana. The state has been ravaged twice by COVID-19. 16 of Louisiana's 64 parishes have per capita infection rates greater than New York City's as the state suffers a second wave of COVID-19. Now, a powerful resurgence of COVID-19 infections in Louisiana is hitting the state harder than its first wave in the spring, making it the only state in the nation to experience two devastating spikes of the virus. An analysis of John Hopkins University data shows the state leads in COVID-19 cases per capita, continuing to outpace even Florida, Arizona, New York, where dramatic surges of the virus have occurred since the outbreak began in March. Now, Louisiana leads U.S. in total COVID-19 cases per 100,000 residents. But unlike those states, Louisiana has been among the worst impacted in the U.S. twice during the pandemic. Once in April, when the New Orleans area led the state's rise in COVID-19 spread, and again this summer when dozens of parishes across the state more than doubled the number of infections they experienced in April. Now that's according to analysis. How the state and Southwest became the global epicenter of COVID-19 pandemic. Well, we kind of might know how that happened. The lack of a few things. Now, Louisiana's experience with COVID-19 offers insight into how a state that took strict shutdown measures to curtail the rapid spread of the virus early on can suffer a more expansive surge after reopening. Well, I mean, I'll just put my opinion in there. The reopening was too soon, and we still had a lot of people who refused to wear the mask for whatever reason. Now, it also reveals how the course of the pandemic in a state can evolve, penetrating new areas relatively untouched by the first round of infection. Louisiana and New York have long been the top states per capita infections, but as New York's cases have largely plateaued in recent weeks, the virus has made a strong comeback in Louisiana. Now, the coronavirus hotspot shifts to the south. Since the beginning of the pandemic, Louisiana has reported 116,280 total cases and 3,835 deaths from COVID-19. Now, that's according to the Louisiana Department of Health's update. COVID-19 has spread far and fast in Louisiana, more than any point. Now, Governor John Bel Edwards, a Democrat in a mostly Republican state, took criticism early in the pandemic for his stay-at-home order that shut down the state's economy in the spring. he has been hesitant to roll back reopening since the latest surge, instead focusing on a mask mandate and a more targeted closure order for bars. Now Edwards already is signaling, excuse me, he likely will extend his mask and bar closure order another 2 weeks. And he stated he hasn't ruled out stronger measures to control the virus. Now, Governor Bell Edwards was criticized for his stay-at-home order in the spring. And that's simply because of the state's economy. People were more worried about money than they were people's health. But it's kind of odd that that would be a big issue, that he would even be criticized for that, because you can't, if everyone's sick or dying from the virus, who cares about money at that point? Now, Governor Edwards tried pretty much his best to take care of it by shutting it down, but everyone pushed to reopen. So that's caused a lot of this to happen. The reopening too soon. Now, it's been said that the most important thing to know is that the situation remains very, very serious, he stated in a briefing. There's more COVID-19 in Louisiana and across every community across Louisiana than in any point up to now. Edwards is right. The spread of the virus is vast in Louisiana after the state began reopening in June, and more prevalent than it was in April's peak. New Orleans is no longer the problem. That spike in July shows just how far and how fast across the state the virus has spread, with the greatest spikes reported in parishes around Shreveport, Monroe, Alexandria, Lafayette, and Lake Charles. Now, this is all according to the analysis. Emergency Department Dr. Doug Clement and charge nurse Erica Granger are facing a new crush of COVID-19 cases at Our Lady of Lourdes Hospital. Emergency in North Louisiana, Madison Parish, the summer spike brought 133 new coronavirus cases, and that's pretty much the worst week in June, an increase of more than 4,000 over the 3 cases reported during the worst week of April's peak. In Vermilion Parish, the summer surge peak came last week with 332 cases, an increase of 1,875% over the 16 reported in the worst week of April. Now, 16 of Louisiana's 64 parishes have cumulative per capita infection rates greater than that of New York City, and that's considered to have the nation's worst concentration of the virus in the pandemic, and that's the early part. One Louisiana parish, East Carroll, has recorded more than double New York City's infection rate. Louisiana's second surge differs, as one prompted shutdown, the other mask mandates. Now, Louisiana's 2 defined peaks of COVID-19 place it among the worst affected areas of the country in April and then again in the summer. Louisiana's first peak in the week ending April 7th, when it added 237.6 new cases per 100,000 residents, the third worst in the country behind New Jersey and New York. In its second surge, Louisiana sprinted past the April peak for the week ending July 27th. Louisiana added 323.2 cases per 100,000 residents. And guys, this is a lot. And it does say a lot about the precautions and the measures that people willing to take, and a lot of people are not taking it, obviously. Although everything has opened up, it may it may show us a lot about how much we actually care for ourselves as well as each other. Now, the states per capita July peak is behind only Florida and Arizona, which are experiencing their first strong spikes of the pandemic. Now, during the first surge, Louisiana had more aggressive measures in place to prevent the spread. Now, Edwards issued a stay-home order on March 22nd and kept the order in place until May 15th, when the state moved into phase 1 of reopening. Even with cases being confined to certain regions, the state locked down, which was a good thing, but I really think that we should have stayed on lockdown, just to be honest about it. I know a lot of people don't like to hear that, don't want to hear that, but it is the truth. Lives are more important than money. Now, it was stated, as we've opened up businesses and society, we're seeing an increase of cases, says Dr. Tina Stefanski, the Acadian Regional Medical Director for Louisiana's Office of Public Health. Well, I mean, of course, because people are feeling free to go and do as they please as if nothing ever happened, stopping the measures as if COVID is gone, and it's not. Now, the second surge began after the state relaxed restrictions. Now, Dr. Tina Stefanski, the Acadian Regional Medical Director for Louisiana's Office of Public Health, said there was not enough compliance with mask and social distancing guidelines after reopening. As we've opened up businesses and society, we're seeing an increase of cases. Even though the virus was clearly still circulating, many people went back to their lives as they were before. It did not change their behavior, she stated. Which is true. I have personally seen this myself. People are not exactly social distancing. They're not wearing their masks. You still have people fighting against wearing masks. And it's really senseless, and it just doesn't make any sense. I get frustrated when I talk about this because this is so important to wear the mask. Now, the combined effects of 2 waves of infections, Louisiana now leads the nation in total cases per resident since the U.S. outbreak took off in March. Now, the New Orleans area has seen significant decreases in daily new cases since its peak during the first surge. Orleans Parish, for example, recorded 797 cases per 100,000 during the week of April 7th. Its peak during the summer surge during the week of July 16th brought only 181 cases per 100,000, which is a decrease of 77%. The same was true for the other parishes that had high case numbers during the first wave. The recent peak for Jefferson and St. John, the Baptist parishes, were 53% and 55% lower, respectively, than in the worst April weeks in those parishes. Many of the areas hit heavily by COVID-19 in the first wave in April implemented mask mandates earlier. New Orleans issued a mandate June 24th. Jefferson Parish and East Baton Rouge Parish started mandating masks July 1st. But the parishes that were largely spared during the first wave are now recording more cases than they did in April. Calcasieu Parish, which includes one of Louisiana's most populous cities, Lake Charles, had a modest peak of new cases during the spring surge with 121 in the week ending April 7th. Its peak in the summer surge was more than 900% higher at 1,245. Now, Louisiana's second surge was not as deadly as the first, yet Louisiana has seen signs in recent days that the state could be approaching a plateau as the numbers of new cases added each day has started to decline. But even with the numbers of new cases falling, the state still has thousands of new cases this week, putting pressure on the hospital system. We hope that we're seeing the beginnings of a trend toward a plateau in cases, although it's at a very high level of cases, Governor Edwards said. During the summer surge, the death rate has not reached the peak that Louisiana hit in the spring. For the week of April 18th, the state averaged 9.9 deaths per 100,000 residents compared to 5.4 per 100,000 for the week of July 30th. Edwards said that while the state may be seeing evidence of cases leveling off, it may take a while for deaths to plateau. Now, the state recorded 69 new deaths, the highest daily count in more than 2 months. So let's dig a little bit deeper. Caddo Parish surpasses 2,500 positive COVID-19 cases. Reopening attractions offer social distancing friendly options. Where coronavirus has spread in Louisiana by parish, 2,596 people in Louisiana have died from COVID-19. We know that deaths are a lagging indicator of what's going on, because the first thing you're going to see is people contracting the illness. Then they're going to go into the hospital and so forth, Edwards said. It could be some time before this shows up in fewer deaths. Now, Stefanski said she's hopeful that the mask mandate will lead to a decrease in infection levels, but it will take time to see the effects of the requirement. While more people are wearing masks, she said, she's concerned about large crowds that continue to gather. I'm really concerned that we're not going to drive down the level of infection in the community to the point that we're really needed to be in order to open schools safely or helping nursing homes get back to some level of visitation, she said. There are implications to people's behavior socially. Now, some Louisiana hospitals prepare for the worst of the second surge. Hospitals in central Louisiana, an area that has experienced some of the greatest increases in infections in the state during the summer wave, issued a plea this week for people to wear face masks and follow social distancing guidelines. We strongly believe that people of this community can help make this happen, the letter said. But to successfully do that, we need everyone to take all needed steps to limit their risk of exposure and help protect those around them. Masks, physically distancing, and hand washing. These things work and can help get the virus back under control in our community. Now, at the governor's news conference, Dr. G.E. Ghali, chancellor of the LSU Health Science Center, Shreveport, said that while North Louisiana has not seen the same large increases in case numbers as other parts of the state, it has seen a sharp increase over the past 30 days. Now, recently, Our Lady of Lourdes Regional Medical Center posted a memo on Facebook written by Chief Medical Officer Dr. Henry Kaufman, which said the current rate of increasing cases will deplete the medical resources of our community. Now, Dr. Kaufman has blamed the resurgence on resistance to common sense measures. And I have to be honest, I do agree with that. As I stated before, it's common sense. Wear the mask, social distancing, wash your hands, and don't crowd up. Chill out, relax. So I agree with Dr. Kaufman on that. I really do. Because it is common sense. Now, in the memo, Dr. Kaufman said the community's resistance to common sense measures was to blame for the area's difficulty in combating COVID-19. Lafayette Parish and other parishes had no mask mandate until Edwards implemented the statewide mandate July 13, which is very interesting. You would think they would take, though every parish would take more pride in their parishes and the health of their communities and mandate those masks. Promote wearing the mask as well as social distancing. Now, where other places have allowed science and reason to guide their actions, the curve has been flattened and the disease has been suppressed to the point where routine personal and commercial activities have resumed, Kaufman wrote. Here in our community, there has been much resistance to common sense measures, and we are reaping the rewards of our abstinence. So there we have it. Come on, Louisianians. Let's do this right. Let's take care of each other. And if you love yourself, your family, your friends, and those around you, you will wear a mask so we can get this thing under control. If not, then everyone's going to be at risk. And there's no sense in that. And I still say we open too early, too eager to make money when there are more things that are more important than money, like living. Because if you're sick or you're dying, you can't spend the money. And at that point, money means nothing. So let's do the right thing so we can get this COVID-19 under control. And actually then try to find a new normal. But hell, what's normal anyway, right?